welcome to Local Edition. I'm Leslie Leyton. The realities of Obamacare are beginning to come into sharper focus as legislators get into their next session in Sacramento. With us now, Assemblyman Don Wagner to talk about that and other things. Welcome.
Hi, Leslie.
AB1X, one of the bills that the governor brought up for you and explained. Please explain to us.
AB1X is the first step in the state's efforts to implement the Obama Affordable Care Act. And what AB1X did, and it came to us carried by the Speaker himself, so there's a lot of very heavy support from the administration federally and in California behind this. But what AB1X does is it expands Medi-Cal eligibility, and it also offers new, and it's optional for the state to do it, but new benefits. And the problem that some of us have with AB1X and this expansion of Medi-Cal is, at this point, nobody has any idea, number one, how we're going to pay for it, and number two, whether we're going to, in a few years, be able to continue paying for it. Some of it gets subsidized by the federal government, but there's no guarantees the subsidies remain. And number three, the total cost of implementing the ACA remains unclear. I'd like to find some answers to those questions before we decide if this is the right policy and a good way to go.
So if you as an assemblyman, someone working in Sacramento, doesn't understand it, who does understand it, and when will we begin to know what's going on?
Well, I'm going to give you a flip answer and say we're not going to know because, like Nancy Pelosi said, we've got to read the bill and we've got to, frankly, live with it to see all its ins and outs before we really know its implications. One example of that is the day before we had that vote on this bill, the San Francisco Chronicle, actually it was a vote on a companion bill, the San Francisco Chronicle ended up with an article about sticker shock, was the phrase they used on their headline on the front page of the San Francisco Chronicle. Now that's not a conservative voice in the media, and even those folks are beginning to realize, hey, we don't understand yet the total ramifications of this. Why be marching directly down that path until we understand what we're getting into and what we're asking our population to pay for? Okay,
so now what you were alluding to was AB2X. Finishing off AB1X was that expands eligibility, meaning more people are going to go into Medi-Cal, which inherently says that's going to cost more because there's going to be more people involved. And then getting on to the 2X, what does that say?
What Assembly Bill 2X ends up doing is the Medi-Cal component was the first piece, but the state is setting up health insurance exchanges for folks who are not otherwise going to be covered. And 2X is, I won't say the funding vehicle, but it's the authorization vehicle for the state of California to move into these exchanges. Now, the exchanges have to be set up properly. The Affordable Care Act is coming, and we want to do it right. There are a lot of people who are uninsured or underinsured that we need to bring into the system so that they're not showing up at emergency rooms and getting their primary care treatment that way. The problem with AB2X is we don't yet know the total cost. We don't know who all is going to be covered. We don't know if the subsidies from the federal government are going to continue for 1X. We do know there's over $1 billion that the federal government wants to take out of California to pay for our portion of the ACA. There's a state tax. I hear it's going to be 4% on premiums for California's part of the exchanges. We have no idea yet. We have no idea yet what that's going to do to premiums. It's going to drive them up. And then the scary thing is that in passing AB2X, its proponents are saying, we're not going to let the free market decide. We're going to have a structured market. That's the phrase they use, a structured market. Well, when government is structuring markets, I don't have a lot of faith that it's going to get it right. And I certainly don't have any faith it's going to be the cheapest way to do it.
Well, thank you for almost starting to clear some of that up. We'll check with you later.